Finally, I'll touch on one more common condition, which is a valve condition, and that's mitral regurgitation or a leaking mitral valve, which is also a very common pathology. Once again, open heart surgery to either repair or replace the valve was traditionally the only modality of choice. Unfortunately, in a group of patients, such as those with heart failure who have a leaking valve, they were at very high risk to have an open heart surgery. And so those patients either underwent very high risk surgery or were treated with medications. So this is what a normal heart looks like. That's the blood returning to the left atrium up here from the lungs full of oxygen, passing through the mitral valve to the left ventricle, which then squeezes out the blood full of oxygen through the aorta, allowing it to pass to the rest of the body. So what happens is over time, as a result of a number of risk factors, whether it's coronary artery disease arising from high blood pressure, high cholesterol, diabetes, or family history, that valve can become diseased, or simply because of age-related degeneration, or because of previous radiation or certain medications. Regardless of the cause, ultimately that valve can itself become degenerated, or the heart muscle can start to stretch and pull on that valve. And what happens is, you can see here in the animation, blood starts to leak backwards, which means instead of all of that oxygen-rich blood going forward into the rest of the body, some of it, and it becomes a problem when a lot of it is going backwards. So the heart's rendered inefficient. And you can see here, these leaflets are not coming together nicely. And so traditionally with surgery, they would do an incision in your chest, they would open up the heart, they would go in there, they would resect a piece of the abnormal leaflet, stitch it in together, and repair the valve. Or if they were unable to repair the valve, they would put a new mitral valve in there and replace the valve, either with a tissue valve or with a mechanical valve, a metal valve that required a patient to be on blood thinners for life. Now, fortunately, this device called the mitral clip was developed. Similar to the transcatheter aortic valve for aortic valve disease, the mitral clip represents a huge step forward in the ability to treat patients who have mitral regurgitation or a leaking mitral valve in a minimally invasive fashion. This procedure is done under general anesthesia through a vein in the leg, again, a small incision less than 1/3 of an inch. We pass a wire through a small hole in the heart from the right side to the left side because the mitral valve is on the left side. We poke this hole, very small hole across, and then through this hole, we actually deliver this little clip device. And you'll see from the animation that the clip device is very elegant in its design. We do all of this just under X-ray in the catheterization laboratory, just the same place where you would have a regular coronary angiogram. We steer this clip down to that abnormal valve. We orientate it in different ways. So it's almost like a robotic procedure, but we're doing it via human hands, not via a robot. We place the clip over where we think the leak is coming from, and then we advance the clip slowly and carefully, and this is done under echo guidance with a TEE, so that's an esophageal probe that's down while you're asleep, as well as the X-ray screen in front of us. We then try and grab those leaflets and bring them together. And what we're trying to do is reduce that leak by bringing the leaflets together. And we're basically emulating what the surgeons do, except in a minimally invasive, non-open heart procedure. And you can see there, we place the clip in a place where we try and reduce the leak. If we don't like it, we can release it and try again. And we do that as many times as needed to make sure we have a perfect result. This is a highly experienced operator-based procedure, meaning if you're considering having this procedure done, you can see on the left the regurgitation on the leaks being eliminated compared to where you started. This procedure is heavily dependent on expertise. And so I would encourage you for any procedure, but especially a procedure like this, to seek out a center and an operator who has a lot of volume of experience.